A Pennsylvania health system publishes rodent prevention basics on the same day we're asking when Dutch quarantine actually ends. Two very different ways the same virus is showing up. If you're just joining, the MV Hondius cluster centers on Andes strain Hantavirus cases tied to a cruise, and investigators are still weighing where the exposure happened, before boarding in Argentina, aboard the ship, or through rare person-to-person spread after someone was infected. Ushuaia officials have pushed back hard on the idea that the Tierra del Fuego tourism hub was the source.
This is Hantavirus Watch. Today, a Franklin County prevention primer, and the quarantine question we've been circling all week gets a real answer. Stick around for that one. If you want to keep up with MV Hondius Andes virus cluster, tap follow so the next episode lands in your feed.
This one's from Franklin County Free Press.
People can become infected through contact with rodent urine, droppings, or saliva. Infection through a rodent bite or scratch is possible but rare. The Andes virus is the only known hantavirus that can spread from person to person, usually through close contact with an infected individual.
Keystone Health, out of Franklin County, Pennsylvania, published prevention guidance yesterday, credited to their infectious disease medical director, Dr. Raghavendra Tirupathy, and 2 medical students. This is community-level rodent guidance, not a CDC or WHO update. So let's be clear about what tier of source this is.
Same Pennsylvania doctor, now co-authoring with med students on a formal prevention piece. Makes me wonder, is Keystone seeing enough worried patients walk into Franklin County that they felt they had to put something in print?
Here's my one correction. The piece names 3 routes: urine, droppings, saliva, and treats hantavirus as one thing. But Andes is the only one that adds person-to-person as a 4th route. So prevention means something very different depending on whether you're near deer mice in the mid-Atlantic or near an Andes exposure.
And that split matters for who this is even written for. If it's return travelers, you'd flag the person-to-person angle. If it's local homeowners cleaning out a shed, you wouldn't. This reads like the shed version.
The one clinical number to sit with. HPS kills nearly 38% of patients who develop breathing problems, and symptoms can lag 1 to 8 weeks after exposure. That's why prevention gets published even when case counts are quiet.
And notice what's not in here, a word about treatment. The public health machine is running full speed, and the therapy shelf is still bare. Okay, so if Andes hantavirus doesn't spread through the air like COVID or the flu, why are health officials going through all the trouble of quarantining these cruise passengers? And what does it actually look like when they say, you can go home?
Right, this is the key tension in the whole response. Andes virus is unusual among hantaviruses because there is documented evidence it can pass from person to person. The risk is close, sustained exposure. Think household-level proximity, rather than casual contact, like sharing an elevator. So quarantine here has a different job than flu quarantine. Find the people who were exposed closely enough to be at risk, monitor them before symptoms appear, and get them care fast if they do get sick, because hantavirus can escalate quickly. The outbreak itself sickened 13 passengers and crew and killed 3 people, per CIDRAP's June summary of the multinational response. The WHO recommended 42 days of monitoring and quarantine, per El País reporting on the international guidelines, though countries interpreted that differently. Canada started at 21 days with a review built in. The Netherlands moved Dutch passengers into home quarantine with daily phone check-ins from the GGD, their municipal health service. Australia flew 6 passengers to Perth under strict infection control protocols covering the flight, the transfer, and the quarantine facility itself. And 18 Americans were placed in 2 federal quarantine centers while officials interviewed them to assess exactly how close their exposure actually was.
So the 42-day WHO recommendation, where does that number come from, and does everyone actually have to hit that mark before they're cleared?
The 42-day figure is tied to the outer bound of the virus's incubation period, the window health officials need to feel confident someone isn't going to develop symptoms. But that guideline still left room for national interpretation. Some countries built in re-evaluation checkpoints instead of treating day 42 as the only release date. If you were on the Hondius, or you know someone who was, the practical advice is still the same. Contact your local health department or a clinician because the clearance timeline depends on your individual exposure level and your country's specific protocol.
If you come to Hantavirus Watch for clear, daily outbreak context, try Ebola Watch, a weekday briefing on DRC and Uganda Ebola updates, case counts, border tracing, WHO vaccine news, and traveler guidance. Find it wherever you listen to podcasts. We've put links to every story from today's briefing in the show notes, so if one deserves a closer read, you can find it there. That's Hantavirus Watch for today. This is a Lantern podcast.